and welcome. It's 11 a.m. here in Seoul. I'm Lee Kyung-eun at the Arirang News Center. We're breaking into our regular session to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Health Ministry official Yoon Tae-ho will be giving us details on the COVID-19 situation here in the country. He'll fill us on the number of new infections as of midnight and the efforts that the government is making to contain the virus, especially with continuing cluster infections here in Seoul and the surrounding capital region. We'll cut into the briefing now. Take a listen.
Let us now begin our regular briefing for December 30th, Wednesday. As of today midnight, we have 1,025 new local infections. And at the temporary testing centers in the metropolitan area, we have a total of 107 people testing positive, and we have 20 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Currently, we are seeing continued rise in the number of daily tallies, and it's hovering around 1,000 for the past 2 weeks. And we are not seeing a clear decline of the cases, while the number is hovering around 1,000 for two straight weeks. And I also have a great pity against such a background, and we will also exert our full efforts, especially during the year-end holidays, and we also will monitor the situation going forward during the year-end holidays. And here are some updates on our quarantine response here in Korea. Yesterday, we had about 100,000 cases, and we are also conducting mass testings here in the country. And a number of 60,000 people have been tested at the testing sites here in the country, and also in the metropolitan area, we had over 40,000 testings. And until now, these makeshift testing centers have tested about 590,000 cases and identifying 1,500 cases of who have tested positive. And we will also extend the special quarantine period for the next 2 weeks as well. And here are some details on our medical capacity. We will be increasing the efficiency of the hospital bed utilizations, and we have about 23 patients who are waiting to be administered in the hospital for over a day. And we also have secured enough beds, and a total of 8,700 beds are available at the life treatment centers as well as other hospitals nationwide. And also we have the designated respiratory disease hospitals. Also we have the COVID-19 designated hospitals, and we have about 200 hospital beds that are able to be utilized immediately. And as we have secured enough beds and high number of beds, we also have critically ill patients' beds, and we will be monitoring at these beds, and we will be monitoring at these hospital beds under the theme of the COVID-19 designated hospitals. And we will also have some response for the cluster infections at the nursing hospitals, and especially these virus vulnerable facilities. We are currently conducting additional massive testings, and we have tested about 200,000 people so far at 6,000 facilities, and identified about 30 people who have tested positive for the virus. And we will also intensify our response measures on the field, and we will also have an organic flow between these response schemes together with the medical circles. And today we will have new TF teams, 3 TF teams that is under the quarantine authorities, and we will also cooperate with these quarantine authorities so that we can have swift management and swift on-site control and management going forward. And especially considering the fact that there are many senior citizens and senior patients who are housed at these nursing hospitals, it is very important that we act swiftly. And it is also very important that the quarantine authorities will provide the necessary means as well as supplies to the medical circles. And also we have the Guro district in Seoul's in the city of Seoul, and we have the nursing hospital there, and we have about 180 people who have tested positive there, and 143 people have been moved, and about 37 people are also left at these nursing hospital, and we also have moved other 200 people who have tested negative, while 92 people also remain at this hospital. And we are separating these people from the space from the virus clean zone, as well as those areas where the COVID-19 patients are housed. And as for the 37 COVID-19 patients who are housed at this facility will be moved to other facilities, and also 92 people who have tested negative, and they will be staying at this nursing hospital, and we will be dispatching more medical staff members. And next, we will update you on the plan to increase and mobilize more nurses. And we have seen a great increase in the demand for nurses as we have a prolonged battle against the COVID-19, and we have also seen a high level of fatigue among these nurses. And we also believe that it is necessary that we have more incentives and support. First of all, we will be securing enough nurses who will be working on site, and we will also expand our 4,000 pool of nurses to about 5,000 going forward, and we will also be having a newly nurturing of 400 nurses to treat critically ill patients, and early next year we will also have 200 more nurses to be nurtured, and we will also carry out further training sessions as well. And as for the nurses who are working to treat the critically ill patients, we will provide more incentives and allowances, and we will also make sure that these incentives will be given to these medical staff members. Today is December 30th, and tomorrow will be the last day of 2020. And the year 2020 will be a year recorded as a year of battling against COVID-19. Up until now, the public has overcome many challenges, and we would like to extend our deepest gratitude to all of our citizens. Enduring many difficulties and inconveniences, the public also had a sense of solidarity and cooperation, and were it not for your efforts, we believe that our quarantine measures would not be possible right now. And as we have the third major wave, and we would also like to extend our deepest gratitude to all of the public for your participation in overcoming this third wave. And last weekend, we also have the record lowest level of the movement of people, and we believe that if we can overcome the virus, this actually will be the last challenge and crisis that we will face in our battle against COVID-19. And thanks for your donations of blood. We also have greater and enhanced supply of blood as well, and we once again would like to extend our deepest appreciation to your support. And we also ask for your continued participation and cooperation going forward as well. And we believe that there are many people who are going through many damages economically, and also a very big heavy toll on their livelihoods. And the government also understands this, and we will provide about 9.3 trillion Korean won of subsidies, and we will be swiftly implementing these going forward. And going forward, the government will stand as a robust pillar so that our people can overcome these economic difficulties. And also against the backdrop of a national disaster, we would like to also extend our deepest gratitude to the lawmakers for your support as well. We believe that there are many medical staff members as well as quarantine officials who are exerting their full efforts on site. We also thank you for your dedication and contribution as well. About 7,000 medical staff members have been dispatched to the scene, and there are also many numerous others who are fighting against the COVID-19. And there are also many public public doctors as well as the military doctors who are exerting their full efforts to treat COVID-19, especially at public hospitals. And we should also mention all of the quarantine officials who have been working under scorching heat as well as chilly weather to have enough testings for the country. And we also shall remember all of the sacrifice put forth by the public servants, including firefighters and the police officers. And were it not for your efforts and your participation and your devotion, it would be very difficult for us to overcome the virus. And we also have many military nurses who were dispatched upon graduation directly to Daegu and Gyeongbuk area to treat COVID-19 patients. And also there are many people, many military personnel, as well as a special corps who have also been dispatched to these scenes to fight COVID-19. And all of your efforts also left a great imprint in our minds. And we believe that there were many difficulties that you must have faced. However, nevertheless, you went to these sites in order to reduce the blind spots of quarantine. And we would like to also thank all of the public servants once again. We are battling against the COVID-19 virus in a very prolonged manner. And however, we have been providing you transparent news. And there are also the media members, media corps, who has been working as the bridge between the government as well as the citizens. And we shall also remember all of the people who are working and volunteering at the sites, especially at the testing centers and life treatment centers as well. And there are many people who have been exerting their full efforts. And thanks to your devotion, we were able to save many lives here in the country. And we believe that this battle is also being continued even at this moment. Looking back at the past year, and looking back in our past battle against COVID-19, we learned that we also had great sense of solidarity and cooperation regardless of our classes and status. And we are also seeing a slight improvement in our COVID-19 situation here in Korea. An author has once said that the hope is like a pathway on the street. And if we combine all of these hopes and this will, we can make a new journey, new path forward for a new journey. And we also are very confident that there are many people who are working side by side to overcome the COVID-19. And early next year, we will also have the vaccines. So we believe that if we can overcome this crisis, we can overcome our COVID-19 battle. It is very easy and simple to overcome this challenge. It is very important that we reduce of the physical challenge, physical contact with other people, and always wear your face mask, and also get tested if you have any suspicious symptoms. And please note that your participation are meaningful. Thank you very much.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 1,050 new cases on Wednesday. Of them, 1,025 were locally transmitted and 25 were from overseas. There have been 20 more deaths, bringing the death toll to 879. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time with a midday news with Mark Broom. Bye for now.